Well, good morning, Cedarfield. We are so grateful that you have devoted about 30 minutes of your time today with Ann Hopper and I. For those of you who don't know, my name is Michael Shaw. I serve as Executive Director.
And I am Ann Hopper, the Clinic Nurse Manager of the Clinic in Independent Living.
Yeah. So we have decided that the antidote to miscommunication and gossip around Cedarfield is facts, good communication, healthy education, so that residents can make some wise choices about the array of services that are available to you here at Cedarfield. One of the things we started to notice back in June of this year was that there was a lot of misinformation about many of the services that Cedarfield offers residents to age successfully. I keep referring it to the safety net. And so today is the beginning of a series of 6 navigation chats that we're going to provide information, some facts and details about 6 very key services at Cedarfield. So hopefully residents are more informed about the service, more educated about how the service can help you now or in the future, temporarily or permanently. And so we wanted to kick off this navigation chat series with the clinic, because the clinic has been here before everybody else. All these other services that we're going to talk about in the next 5 iterations of this series. The clinic has been here since 1996, and it's not going anywhere. The clinic will be here for the next 25 years at Cedarfield. It's the nucleus, it's the center point of coordinating care and services, amenities, so that the residents at least know where the starting point is at, of how to navigate services, particularly clinical services at Cedarfield. So Ann and I are gonna, it's a kind of a question answer format. We've taken a lot of our questions straight from the resident handbook that you have available to you. And so, without further ado, I think we should just jump right into it.
Sure.
Right? Okay.
Sounds good.
So hopefully you all know Ann. If you haven't had the pleasure of knowing Ann or got to get to know Ann quite just yet, I would encourage you to come down to the clinic. I don't know about, well, I do know. In my home, I know I don't have a nurse in my own home. I have a speech pathologist, my lovely bride, Julie, but I know I don't have an RN in my own home. The residents of Cedarfield, you have the fortune of having an RN in your own home. So if you haven't gotten to know Ann yet, you'll be better off for it. So let's just start off with the first question. Very simple question. What are the hours of our wellness clinic?
That's a great question. The clinic is open from 8 a.m. to 4 p.m. Monday through Friday. It's closed on the weekends and holidays. But our phones are forwarded once we're closed to healthcare, and there's always a nursing supervisor available when the clinic is closed. And the supervisor would respond to emergencies in independent living.
Right. Okay, great. Second commonly asked question are what are the services, the clinical services that you schedule on behalf of the residents inside of that wellness clinic?
Okay, so we have a variety. We can, obviously, like Michael said, you can come see the nurse. We have our physicians in here, and the physicians are anywhere from the primary care doctor, Dr. Cook or Dr. Shear, to our specialty doctors. So we have a dentist, we have an audiologist, we have a podiatrist, we have optometry. We can schedule home health through the clinic, outpatient therapy, we do labs, we can do x-rays, that's throughout the month.
Okay, great. So the clinic is kind of the hub of coordinating and scheduling all of those services on behalf of the resident.
Right.
Yeah. Good. Good. Another good question is there's this did we hear about this clinic calendar? What is the clinic calendar, and how can I get access to the wellness clinic calendar?
So we can send out the clinic calendar electronically, and it's also put in the in-house mailboxes and out to the cottages. Bonnie Berry does that once a month.
Oh, good.
And it lists everywhere from when we have pre-move-ins with Dr. Varanian coming in to do those health and physicals, to our regularly scheduled once a week doctor appointments, when we do labs. And so one side has the month and lists everything that, what doctors will be in, what days. And then the next side of it, the back side of it, lists all of them with phone numbers, and it's self-explanatory as you call, say, the dentist to make that appointment for them, or you call the clinic to make the primary care appointment.
Okay, great.
So, and there's always, you can call Bonnie or myself with any questions.
Okay, great. And can you access the clinic calendar on Touchdown?
That's a good question.
Okay.
I will check into it to make sure it's put on. It should be.
Not that I'm trying to stump my own guest. We'll check and see if it's on the
but we can definitely put it on.
Yeah.
Yeah.
Okay. And that's published monthly.
Yes.
Okay, good. Good. Okay, next question is what in the resident handbook it talks about emergency response and first aid that is delivered by you and or your team. What's that all about?
So if someone has a problem walking out in our community and they trip and fall, if they have a pendant or someone walking with them or someone sees it, press the pendant, it goes to you have a walkie-talkie, I've got a walkie-talkie, it goes to phones, so a whole group of us will get this emergency, and the clinic is responsible for calling, finding out, was it a mistake or do you need us? And once we hear we're needed, we go with our bag, and whether it's first aid, someone falls and they're bleeding and we know they have to go out, we're going to go ahead and at least wrap it up and get that bleeding under control before they go out. We might call and they're in the apartment and say, my spouse needs you, they're having trouble breathing, we're coming. We might say, call 911, we're on the way, to not have any delay in treatment. And then when the clinic is closed, that once again, the nursing supervisor would respond to that emergency.
Okay, good.
So
the nurse supervisor that Ann's referring to is an individual that comes on to shift about 3 o'clock every day and then stays through the evening all the way through 7 o'clock the following morning, 7 days a week.
Right.
And usually that person is it's an LPN and sometimes it's an RN.
And then the other part to that is we do for the continuation of care, we would call up and give a report as to say if we sent someone out, so that supervisor's aware that, hey, we sent someone out, they fell, you'll check on them, to see what they need when they come back. They might get stitched and come back to IL. They don't have to go to health services, but we're going to call and say, are you doing okay?
That's a great point. So what you're saying is that nurse supervisor knows of every resident that's at any hospital in the area.
Right. We have a report, and it goes up, and then when it's pretty new, we'll make that phone call, and then the supervisor will follow up. They'll follow up with the hospital to see where they admitted, so that we know for when we come back, and the next shift, 11 to 7.
Well, and the other good thing about that is sometimes the hospitals surprise us, imagine that, and they discharge the resident in the middle of the night. And so this report that Ann's referring to, at least it gives the nurse whose primary home in the evening is in the health center, it gives them information as to where the residents are located in the event that somebody is discharged back to independent living in the middle of the night.
Right.
So another interesting question about emergency response: Are we taking the replace of the paramedics in the emergency response? Are we now the paramedics?
No.
Oh.
I mean, we will be the first responder.
Ah, okay.
And so, once again, if it's cardiac or stroke, sometimes someone will call and say, my husband's having a stroke. We are not trying to make the resident the paramedic, but we don't want to delay in treatment. We're call 911, we're on the way. And so then we show up, and then we take over. And then once the responders show up, they take over.
Okay.
So it's just the first one to respond.
Yeah, okay, good.
Yeah.
Good.
So we're limited. As much as Cedar Field is wonderful, there comes a time where there are just certain things, like we'll call the doctor and say, Dr. Shear, Dr. Varani, and Dr. Cook, hey, this is what's going on. And like they'll say to me, what we're really trying to do is rule out the big stuff. And we can't rule out big stuff here. So while it seems like a waste of time to go to the hospital, it's really important because we're going to have peace of mind that, okay, the big thing didn't happen, the stroke or the heart attack didn't happen. Now you can come back and we can help you out. Mm-hmm. But we can't do any type of testing, the big tests, here at Cedar Field. And time is important.
Right, time is important. Although, little commercial break for one of the services that we have partnered with. So if a resident does not want to go to the hospital, and it's not an acute situation, mm-hmm. meaning someone's having, looks like a stroke or congestive heart failure, we partner with a company called Dispatch Health. And so Dispatch Health can take the place of an emergency room for all those non-acute situations and come right to your apartment and or your cottage, or those of you that are living in assisted living can come straight to your apartment as well and do a whole array of services.
Absolutely. We have used them for a while now, and it's basically an urgent care on wheels, and they are phenomenal. They have come out and stitched. They have the nasty GI bug that can be out and about. They have come out and hung a bag of fluids, and it's either a nurse practitioner or a physician's assistant. They come out with an assistant, and they probably have 6 suitcases, and depending on what your need is, they come wheeling in with their suitcase. But the nice thing about it is that NP or PA can write orders for an x-ray. They can do labs right there on the spot, and they get their results right there. But they also have the antibiotics. So if you need to get started on an antibiotic, you can get your first dose while they're still there and
great.
Calling in the prescription. And I always say Dispatch Health is phenomenal. Besides during the week, they're open 9 a.m. to 9 p.m., 7 days a week, 365 days a year. So that covers your nights and weekends, especially if you have a doctor out in the community and they're not on call. The on-call doctor doesn't know you. They're going to say, go to the ER.
Right.
And we know no one wants to go to the ER these days.
Nobody wants to go. In fact, my son didn't want to go. Last year when I was helping him learn how to ride a bike, he fell off the bike. His helmet also fell with him, and he hit his head on the blacktop. And so what did I do?
Called Dispatch
I called
Health?
Dispatch Health. They came out to my own home and stitched him up, and I saved myself 3 hours from sitting in the waiting room. So,
exactly.
Wonderful service.
And may I just add that Medicare, it's covered by insurance and supplemental. Most of these programs we're going to talk about are covered by your primary and then supplemental. Yep. So where you and I might pay our copay like we do for Patient First, and Dispatch Health will see anyone 3 months and older out in the community, like Michael's saying too. So your families can be aware of them.
So the whole point here is that Ann and the team and all these nurse supervisors that work throughout the week have available to them a partnership that they can draw on to avoid a non-acute emergency visit. So
right.
Okay, we're going to move on to the next question. What does Cedar Field Wellness Clinic provide? The services that you provide, that you have been providing, your predecessors have provided, and we will continue to provide in the wellness clinic.
Exactly.
What are those services?
The big ones are, we do blood pressure checks. Sometimes people don't feel well and they just want to come in. Their outside doctor might say, hey, get your blood pressure checked by Cedar Field, by the clinic. A couple times a week, we want a history of it before we either change your meds, put you on meds. We do the welcome visits when someone first moves in. it's a lot of information here, and it can be confusing. So we want to introduce you to the team, social work, what the clinic can do, who our doctors are. So that's a little bit more involved than just this Q&A right here,
Right.
One-on-one. And then if we need to talk, basically like a little care plan, whether it's about a spouse, someone moving in, what do I do next? You know, do I keep my doctors outside? Do I move? There's just a lot going on at Cedarfield. So we do that. Weight checks with the pandemic. You know, we had people that were isolated, so they weren't eating in a group. And that's a big deal. We don't want you losing weight. Women want to lose weight, but we don't want anyone losing weight. And then, of course, our emergency response, we talked about that.
Right.
There's always any type of appointment. You want to talk to me about upcoming surgery, how we can support you there. Like Michael said, we're the hub for pretty much anything that's going to go on. You might have surgery scheduled and you plan to go back to your IL apartment and have your spouse take care of you, and you think, I don't need the clinic. It's good for us to know. We can check on you. There might be services that we can support you with that your spouse doesn't have to become a nurse or your caregiver, and you're still in your IL apartment.
Okay, great.
So we'll do that. And then we also will call and follow up after you've been in the hospital and come back. We have more. I can't go to apartments and see people when they come back, but we have Affirmation Home Health that we can have them, a nurse would come out and see whether it's a new diagnosis, new medication. Just, it's a lot after being in the hospital. You're weak. So Affirmation can come in nursing services as well as therapy, speech therapy, occupational therapy, and physical therapy in your apartment or cottage.
Okay.
So while you're still healing, recovering, and just slow to get going after being in the hospital, you don't have to go out anywhere. They come to you.
Oh, great.
So that's nice.
Yeah, that's wonderful.
And then we have, once again, our physicians. We've got, if you have Dr. Cook or Dr. Shear as your primary doctor, they are in the clinic once a week, and Dr. Shear will also see acute sick visits. So you might have your doctor out in the community, and that's great. You keep them. Maybe you can't get to them, or you're feeling terrible, and we call dispatch health. It's going to take a little bit longer, but Dr. Shear happens to be here. She could either see them in the clinic, and she also makes house calls. So that's a nice little perk.
Just a little plug for the physician services in the wellness clinic. For those of you that have had a physician, the same physician your entire life, and you've noticed that that physician or have been given notice by that physician that they're either retiring
Right.
or they've been bought out by somebody, or you just want to simply learn a little bit more about the physician services here at Cedarfield. I know Dr. Shear, Dr. Varanian, and or Dr. Cook would love to just chat with you so you can get to know them before you even make a switch to determine if one of these three physicians would be the right fit for you as your primary care doctor right here. Mm-hmm. And so by having that physician, potentially one of the three here as your primary care doctor, it actually strengthens this safety net that I keep referring to, because those doctors are here pretty much 5 days a week and are helping us help you coordinate a whole array of things that we have available for residents.
Exactly. We call it a meet and greet if they want to see one of the doctors, just to hear their philosophies and see if you connect before you sign up with them. And then what we'll do is Bonnie will have the form filled out so we can get the information from your prior doctor. And what's nice about them, it's easier for me to reach these doctors. As Michael said, they're here, they're not here like we are Monday through Friday, but one of them is usually on campus, and it's easy for me to access them. And then if you have to move through the continuum, or you're in healthcare for the knee replacement that you weren't expecting, it's nice to have that doctor follow you up in healthcare because they already know you from this IL side. So not a plug that you have to switch, but if you do, we are happy to help you with that.
Yeah, absolutely. Wow, time is flying by. We've already been here for 20 minutes. We have
Wow.
9 minutes left. Just one more touch on if you're opening your resident handbook. We're on that one page that says without a fee or with a fee. On the right-hand side of that page, it talks about with a fee and injections and IVs and blood sugar checks. Ann Hopper has hardly ever used or residents have partaked in those services in the clinic. So when we talk about IV fluids or
Right.
injections, those are all things that our home health company can
Absolutely.
have access to. And we're really not taking away anything from a resident because Ann really has not, I don't want
Right.
to put words in your mouth, but
Right. No, we don't do that often. As far as the IV antibiotics, I know a couple of times in 6 years, and we do charge a fee through the clinic, whereas a home health company, your Medicare is billed, and so there is no fee.
there's
involved.
no deductible either.
Right.
Yeah.
Right.
Good. Okay. So, let's go up to what is Helping Hands?
All right.
A lot of misinformation about Helping Hands. Helping Hands is part of the clinic now. So
Right.
what's
So-
Helping Hands?
So Helping Hands, and this might have been confused through the years because what did it start in 2008?
Yeah.
So it was established as just as a temporary intervention to help the residents before they move through assisted living.
Okay.
So when we didn't have the space available, we're trying to keep residents independent, but we knew there was a struggle there, whether it was getting to meals, whether maybe they weren't remembering to take their medication. And so there was a wait list to get to assisted living. Now we've got the room available, and so really Helping Hands is just the bridge before the resident gets to assisted living. That is the plan.
Okay.
That you can be on for meds, that we check and make sure you're taking them, getting the meal. Once again, we don't want you losing weight while you're waiting to go over to assisted living.
Right.
So,
Good.
I don't know if you have anything to add
Well,
to
we're
that.
one of the 6 chats coming up here, navigation chats, has to do with Helping Hands.
Okay.
So we'll have
We'll be
more.
back.
We'll have more information about that to come throughout the next couple of weeks. Physician services we touched on. Your
Mhm.
medical team. Do you have any other information about Dr. Shear or Dr. Varanian, Dr. Cook you'd like to share with
So,
folks?
Dr. Varanian he's our medical director. He does the pre-move-ins, and he was integral in our COVID, the planning, helping us with the pandemic, get through it, as well as Dr. Shear. And so we still reach out to them. The other two that we don't talk about that are great finds, Dr. Shelp has been here 20 plus years. And
Since
he
the
is
beginning, 25 years.
yeah. So
Psychiatrist has been here for 25 years.
and he is phenomenal. And everyone thinks, oh no, the
Unbelievable.
psychiatrist, no, we don't have a couch in the clinic. And he's calm and he's kind and he's just unassuming. But what's nice about him is he helps with the cognition problems, so he can talk to the resident with cognition problems. Sometimes it's just like, why is this happening? They just need someone to talk to, and then the caregiver, the spouse, really needs it. So sometimes he will see the couple together, and then he'll see them individually, and he goes through the continuum. So if someone moves into memory care, into Morning Glory, and there's some problems with the transition, Dr. Shelp will be down to see, or up, to see that resident and then talk to the spouse or the family to see how he can help. And it's not always medication related.
Right.
So there are interventions with him. And then the other one is Dr. Palmore. She's been coming 25 years.
Yes, she has.
She's our dentist. She comes in 2 times a month. She does her own cleanings. She has no assistant. And she'll do everything. Root canal, crowns. I mean, she does it all. And she's another one that carries her little bag with her. So she's phenomenal.
Yeah, that's great.
Yeah.
Good. Speaking of phenomenal, the social services team, Kathy Moran and Christina
Craig.
Christina just joined our team within the last couple of weeks. Kathy Moran has been here
Going on 23.
Going on 23 years. The social services team report in through the clinic because social services, I refer to social workers as navigators, helping people navigate through the maze of healthcare. So do you want to talk a little bit about your mighty team of two?
Well, they are phenomenal. And what's nice about social work is they are the hub. They are the starting point too. Someone moves in and there is transition trauma. It's a lot. Downsizing, moving into this big facility. What do we do now? Who do I call? I have this handbook. There's so much to read. The social workers are involved with the new visit too. So you'll meet them at the new visit. You'll meet them at the pre-move-in. And that's the start of not social workers coming to move you through the continuum to the next level of care. No, social work is your friend to lift you up and support you in whatever you need. Whether it's, maybe your neighbor you see is struggling. What do I do with that? You get in touch with the social worker. It's just a rough time, a little bump in the road for you. Social work can help with that.
Absolutely. I refer to the social workers as your navigator. They are unbelievable. They have a gift of knowing of all the services and amenities at Cedarfield. And when you connect with your social worker, your navigator, they're automatically starting to think about what services that you could access temporarily or permanently to age successfully. So,
and then another part is they're very involved talking to families. When your family's, all of a sudden a family member might reach out after the holidays and think, oh, maybe my mom needs a little bit more help. Doesn't mean they have to move through the continuum, but what support is available? And so social work is a great starting place for family members.
Yeah, that's great. You want to talk, we have a little bit of time here left, 2 minutes. You want to talk a little bit about laboratory services?
Yeah, so we can do labs. We do them usually Tuesday and Thursday, but I have 2 scheduled today too. We can do them from outside doctors, so we get orders sent over to us, and the labs go off to LabCorp, so it's just like what the doctors use out in the community. And we can do stat labs, and then our doctors here order labs. So we do that and, get them back in a timely manner, and that's helpful. And then we have our... the Dynamic Mobile is a mobile x-ray, and that's really helpful. They do ultrasounds, x-rays, and so once we have an order for that too, outside doctor or a primary doctor, they'll come in and go right to your apartment or cottage, and that's really nice too, not to have to go out for that.
That's great. Anything else you'd like to share with folks?
I don't think so.
No?
I think we covered a lot.
We did cover a lot. Action-packed 30 minutes. We hope this navigation chat has been helpful for you. We, again, just a little plug for this one document that we published on July 21st that talks about the safety net, all the services and amenities that you have available to you as a resident in independent living, assisted living, or healthcare. I refer to this safety net as the net that you would want to tap into to age successfully, and this clinic is just one enormous piece of the puzzle of our healthcare delivery system that you have available. So,
and I'm happy. That is a wonderful document, and it's very long and involved, and the social workers and I are happy to go over it, just pieces that you might need at a time, because you might look at it and think, oh, this is great, but when do I use it? And that's when we can help you figure out when you use.
That's when the navigators swoop in.
Exactly.
That's great. So hopefully this has been helpful. If anybody has any questions about this navigation chat, please feel free to contact Ann Hopper and or her navigators, Kathy Moran and Christina Craig. Certainly feel free to contact the administration suites. However, our next navigation chat will be November 18th at 1:30. We're going to talk a little bit about affirmation home health, the power of home health.
That's great. And what are they going to be coming up with December 1st, I heard?
Oh, December 1st, the little commercial. We're going to, on December 1st,
Yes.
Affirmation is going to start rolling out home care services. So we'll talk a little bit about that on the 18th.
Yep.
So in the meantime, just one little plug to squash a rumor. Home health is not something you want to tuck away and save for a rainy day later on in life. Home health, people have been paying into Medicare for years and years and years. It's a benefit that you have available to you.
Right.
And so there is no deductible.
Right.
And it's just a pleasure to have a partnership with this organization to help you
Exactly.
in the clinic and help the residents
Right.
with another amenity to age successfully. So hopefully we'll see you on November 18th at 1:30 for that navigation chat. Until then, thank you for joining us. Appreciate you listening, and we'll talk with you soon. Have a great day.
Bye.